What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. And today we'll be covering how to work with geriatric patients for those going into the clinical department. To give you background, I am an Xray tech who works in the emergency room, level 3 trauma graveyard shift, 8 to 8 p.m. So a lot of the geriatric patients you'll have kind of fall in different spectrums, and with time you will kind of gauge and you'll be able to kind of assess the situation, because you have the ones that are like, you show up and they're like you and me, just good. Hey, how you doing? I'm 80 or 90 and they're still pretty good. They're like, oh, we're here to do your x-ray. They're like, okay, beep. Okay, we'll send them off to the doctor, shebang, shebang, or they'll be in pain because they fell or something, but they're understandable and they're like, cognitive, and you'll be able to, do your work still. And then you have the ones that come in and they're like, where am I? I hit my head. And you just see like a big old thing. They're like, I'm confused. And then you try to explain it to them and they'll be like, okay. And then I guess the thing will reset and it's like, what are you doing? And then you have those. And then the other ones who like won't let you do anything type deal. Like they'll have to be strapped down kind of. Or like their family members will have to hold them and try, like, I guess Alzheimer's and stuff. So you'll have those kind of patients that will come in. And then you have the ones that are just straight up just almost like not brain dead, but they're just there chilling. And you'll come in, you tell them what you're gonna do, and they're just like, meh. They're just kind of over it type deal. You'll have those. And then a lot of the times I've noticed that a lot of the elderly patients, well, I mean, any patient in general, you should tell them what you're doing as you're doing this stuff. Like, they will want that more than the other ones. And you try to be, you'll get more, I guess, background into what happened, because they'll go in depth. Or some of them, they just want someone to talk to, so you'll sit there and you'll try to do, or as you're doing your exam, they'll be like more talking to you, and you have to be kind of, making sure you're actually doing your job still, so you don't get distracted, because sometimes they'll end up talking to you a lot and you'll get distracted, and maybe you'll like place the board on the wrong side, or you'll x-ray the wrong part. So you kind of sometimes, keep that in mind, that they do that. Or sometimes they'll be very needy and they'll like, oh, can you get this? Oh, can you get that? Can you get that? And then especially if it's like water and stuff like that, the nurse is like, nah, you broke your femur. The doctor don't want you to do nothing because of MPO, because of surgery, whatever. Sometimes they'll be more aggressive because they won't understand why you're doing said things. Or sometimes they'll be coming from retirement homes. They'll bring them down in like stretchers and EMSs and stuff. And other ones you'll get like patients who, like, once they hear the news of what happened and you maybe had to come in to get like a x-ray for like surgery, pre-op type stuff, they'll kind of be freaking out about what happened, and they'll tell you everything, or they can't understand, or they ask you to see the pictures, which they can't. So maybe they get a CD and stuff like that. So, you being in this field, you see a lot of elderly people who come in. Especially nighttime, people fall. Cookies. I had one fell for some cookies, double stuffed, got her. Bless her heart. But anyways, yeah, a lot of geriatric patients, especially the boomers, as we call them, that will come in a lot of the times. And it's sad, or maybe it's because when you work at the hospital, you see kind of the bad. But like, you look at all these people that be coming in with all kinds of diseases, or like funguses or wound infections, and you almost, a part of you is like, is this what's gonna happen to me when I get old? Or are these just like the very bad percentage of people that just didn't take care of themselves? Or other ones, they were just literally, you were pre-positioned in your DNA for that to happen, and you can't control it. So I have that kind of stuff. And then other times you'll see them and you're like, you know what, I'm doing pretty good. Let me just keep on, doing what I'm doing, staying in my little fitness journey, whatever. Let me just try to be healthy, and hopefully I end up like those who like are 99 and just like walkie-talkie doing everything good. So yeah, it's been your boy Miguel. Hope you enjoyed this knowledge. I'm about to clock in, do my 12 hours of the work. See ya on the next one.